Hello everyone and welcome to today's podcast. Today we will be discussing a very important topic about autism. Now there are a lot of myths and misconceptions regarding autism. Some of them can be offensive, misleading and even confusing for the parents. So to discuss regarding this, we have Dr. Prathima, a developmental pediatrician who's over here to debunk these myths. Hello Dr. Prathima.
Hello.
Thank you for taking time and joining us in today's podcast. So Dr. Prathima is an experienced neurodevelopmental pediatrician. She did her initial medical training in Hyderabad and completed her MD Pediatrics with a university gold medal. She undertook further training in the UK, including tertiary centres in Newcastle, Manchester. She worked as a developmental pediatrician for over 10 years in Auckland, New Zealand. So we are grateful for Dr. Prathima for accepting this request to attend this podcast and clear all your doubts. Thank you.
Thank you.
So just as the saying goes, lies get around halfway around the world before the truth can actually put on its pants. And regarding autism, parents get to hear so many things. So we've listed down some of the few myths what we commonly hear in our OP practice, and I'm sure you would be able to help parents out in these things. So the most common thing what we get to hear is that autism is a disease. So what do you say about it?
Very good question, Dr. Mulya. So basically a disease is a condition where you know the process, the mechanism of the condition and the manifestations. Whereas in a disorder, you don't know the mechanism, you don't know why it occurs. And autism is one such example, where you can recognize the condition based on the behaviors and the clinical picture, but you don't know why it is happening and how it is happening. So from that point of view, autism is a neurodevelopmental disorder. Also, the frequency of occurrence. There is some data coming from America, CDC, that the prevalence of autism is 1 in 42. What does that mean? That if you go to 2 classrooms, you might see a child on the spectrum. So it is as frequent as that, and therefore the conclusion that it is a disorder rather than a disease.
So we have seen number of children having autism actually been on the rise over the last 2 years.
Yes.
And there's this common belief saying that vaccines cause autism, and many parents avoid giving MMR vaccine to their child thinking that it can cause autism. So how far is it true?
So Mulya, back in 1998, this idea first was introduced in the form of a study. But that was a very small study of only 15 kids. And then very soon it was found to be flawed and investigated and subsequently disproven. Over the next couple of years, there were many other studies that looked into the link between autism and MMR vaccine. They also kind of looked at the role of thimerosal, which is one of the preservatives, and that was disproven. The CDC undertook a vaccine safety exercise and probed lots of studies looking at not just MMR but a range of vaccines, and it has been proven through a number of studies that there is no link, because kids who haven't had the vaccines also have developed autism. So as far as evidence goes, we have actually clear evidence that there is no link between the two.
So parents, we do have evidence that autism is not directly linked to vaccines, so do not hesitate to vaccinate your child, as it's important to prevent the vaccine-preventable diseases. Another common myth what parents think that autistic children do not have emotions, or they find it difficult to have relationships.
Once again, autism is not a homogeneous condition. It is a spectrum, which means to say that a certain child can have a milder end of the spectrum, a certain child can be on the middle of the spectrum, and some children can be at the severe end of the spectrum. And there have also been sort of studies which have shown that children on the spectrum do have empathy. However, children on the spectrum struggle with responding appropriately to situations. For instance, a child may see his sibling fall down, but will not know how to react, but will feel for that child. So to kind of say that all children don't have emotions is incorrect. It's again a spectrum on the spectrum. Some can, some have difficulty, and some have difficulty responding to situations appropriately.
Maybe they have different ways of expressing.
That's right. So they may laugh, when somebody's hurt themselves. So it's basically their social emotional development which is delayed.
Yeah. So it doesn't mean that autistic kids do not have emotions. It's just that probably they have a different way of expressing, different way of feeling these emotions. The next thing is autism. People like children who have autism are non-verbal or they cannot speak at all. So that is what most people believe, and parents are sometimes in a denial saying my child can speak few words, so it doesn't fall into the spectrum of autism, and then they take a back seat to actually intervene or accept and help the child. So what do you say about that?
There are once again it is a spectrum. So the children who are at the severe end of the spectrum could be non-verbal and will have no language and a huge communication difficulty. But there could be kids on the milder end of the spectrum or high-functioning autism, which what we call, who can have an amazing language ability. In fact, they would, at age 2 or 3, they would use words which their parents are quite impressed with, and we call them hyperlexic. So, and some of them have got their language maybe age appropriate, or they would have enough language, but there are qualities about the speech which could be different. So again, you can't paint it with the same brush to say all will be non-verbal. There is the whole spectrum there of being very verbal and competent with language and non-verbal. And a child having a few words will not rule out autism, because you can have the ability, but you can have the other features of autism.
So as Dr. Prathima said, it's a wide spectrum of symptoms. Some can fall in the mild category, some can fall in the severe category. So the presentation can vary and it differs with each child. So there's this another common belief that girls are not affected with autism. But we do see quite a number of girls also having it. So what is your take on this?
Historically, we've always thought that boys are overrepresented. Autism is overrepresented in boys. Anecdotally speaking to a lot of colleagues now post-pandemic, they have reported that they're seeing a lot of girls with autism, and it seems like it's changed. However, in my practice, I see a lot of girls on the spectrum, and the unusual thing about girls with autism is that they present late. They've got a better language ability, a lot of them, and even their social ability is a bit better than boys. And so they are able to conceal their autism to some extent. So when they turn up at age 9 or 10 and I diagnose them with autism, then I get to know the struggles that they have had, and they have hidden them or concealed them. So the autism in girls looks a bit different, and in fact there are research studies to say how challenging it is to diagnose autism in girls, but it's important to bear in mind it impacts girls as well.
So probably, like you said, maybe the symptoms are more subtle in girls, but it's not that they do not get it. So always have suspicion in your mind if you find certain behavioral things which can be suspected of autism in that child. So there's a lot of, again, scare among people that autistic people can be very violent. And some might not be ready to accept to be in a place where there are other people with autism. So what do you say about it?
That is certainly not true, because now there are about, the understanding is that there is about 20 or 30% of children on the spectrum who develop neuropsychiatric symptoms, and behavior and challenging behavior can be one of those manifestations. But it is a proportion of the children, it's not all the children. In fact, a number of children on the autism spectrum can be very passive and very well behaved, and they are very over focused in their own interests and don't really bother with other people. So once again, it is not a feature of all children on the spectrum. There is a smaller group, and usually the ones who are moderate to severely affected, and those that from the start present with rigid behaviors or very sensory behaviors that they find very difficult to cope with in the first place. And therefore it's important with any challenging behavior to actually determine what is the trigger for this. And that's actually analyzed by the behavior therapists and then managed. It requires input from behavior therapist as well as at times a psychiatrist as well.
So as Dr. Prathima rightly said, we cannot label autistic kids as violent or non-verbal or not having emotions. Every child is different, the same with autistic children. Every child having autism is different. So we need to have a broader angle when we look at them. So coming to the treatment, now there's so many things, so many in front of parents, and they get confused. What is right? What is the right thing we need to do? So there's this popular belief again that medicines can cure autism, certain foods can cure autism. So what do you advise parents?
Probably one of the most important questions for autism treatment and management. The very fact that we have got such a plethora of treatments just tells us that we, at present, that we don't really know how to cure autism. And that's the fact. At present, there is no known cure. We are still researching, we are still in search of that holy grail of autism. There is no metabolic marker or biological marker which would say this is autism for us to actually manage that. So which means to say we don't have an MRI test or a genetic test or a blood test that clearly says there is autism. So in absence of the knowledge of what causes autism, we don't have clear treatment. So a number of things are being experimented at the moment and they've been researched. We have varying levels of evidence, but at present either the studies are small in number or the design is not, captures all aspects, or it's inconclusive, or numbers are very small, and therefore at present the state of play is such that we don't have a clear guideline on treatment of autism other than the approach of therapy. So at present we've got a number of things that are being tried. We've got diets, we've got the stem cells, we've got cannabis, a number of drugs like N-acetylcysteine, bumetanide, and then there is nutritional supplements which are being sort of looked at. And one can understand parents are desperate for answers and are looking at the slightest hope to treat their child on the spectrum.
Trying every way as probably
yes.
This could help.
Yes, yes.
And we've heard a lot about the stem cell therapy for autism over the last few months, stating that probably it's not the right way to do it. So what is your say on that?
Yes. Around about last year, we were watching with bated breath some of the studies that were going on, particularly the Duke study in Chicago, which was on to its phase 2, looking at the role of stem cells. And I think initially we had some sort of initial encouraging results of its impact on children who have high IQ and between the ages of 4 and 7. But at present, as of now, there isn't any clear-cut benefit at this point. And in India, we now have a guideline, and the Medical Commission has looked into it and has actually issued a very clear-cut guideline that stem cell treatment is not to be used for treatment of autism. In fact, they are regulating this quite tightly. So for the present time, stem cell should not be used in the treatment of autism. And we will have to wait for more substantive sort of results and bigger research for answers.
I'm sure we know a lot more than what we knew before, but there's still a lot to know about autism, and everyone is trying to find out in their own ways as to how this could be handled better. It's like probably it's just a drop in the ocean what we know. So what is your last advice to parents whose children have autism?
I think the first, at present, probably where we could sort of step in is, and what I would advise parents with young children, is to be very opportunistic with the developmental surveillance. Meaning to say when they come to their pediatricians for their vaccinations, to make sure that the development of the child is reviewed. So the IAP gives a guideline that at 18 months, have the kids checked out for autism in the form of a very simple screening test, the MCHAT. In fact, and the Americans are sort of encouraging that the screening be done much earlier as well. So I think before the age of 18 months, for the development of the child to be checked and for the signs of autism to be picked up as early as possible. And when kids are diagnosed early, we can start early intervention. And there is evidence that if we start early intervention, then there can be improvements in the developmental outcome. So at the present moment, that's our hope. And I would encourage parents and pediatricians to screen children for autism as early as possible.
So as you said, early screening of children with MCHAT that's readily available online, and even at the regular vaccination visit, make sure that the child is developing well. The parents themselves can question the doctors. I think as a community, the awareness of autism should also increase. I'm sure it's much more as compared to what it was 5 years back, but I still at the grassroots levels, there's still a lack of knowledge regarding autism. So as a community, probably, they should be more aware about it as well.
In terms of understanding the possible causes of autism, we have always suspected a genetic component. But generally, when we investigate particular children, it's about 15 to 20%. There are other unknown factors, whether that is environmental or metabolic, etc. We don't know. Through the pandemic, however, the descriptions of what families tell us about, the role of isolation, plenty of screen time, spending hours in front of the screen, not interacting much with other people. Whether this has got a role or not, it's certainly
still debatable.
But that may be one of the things that, parents can sort of, take precautions to avoid. I think it once again goes back to the first 1,000 days of a child's life. The connection between the mother-child connection, the attachment between mother and child, and avoiding all these extraneous factors such as screen time. And I would also sort of go as far as to talk about more connectivity with community. Yes, because the factors that impact development are at multiple levels, as we recall Bronfenbrenner's ecological theory, and they are at multiple levels. So I think it's important that we protect the family and the community and protect our children and support their development.
So when a parent gets to know that their child has autism, it's out of blue for them. They feel the world has changed, and the first question what they would ask is, how will it be 10 years down the line? How would my child be? So what do you usually tell such parents?
It is a very difficult question for a number of reasons, and conveying that uncertainty to the family can be quite challenging. Families are looking for that little glimmer of hope, and they are wanting, in the midst of all that, for their child to be not only autonomous with how he manages his life, but also independence. Eventually, a lot of families want to know whether their kid can grow up to be an independent adult, have a job, marry, have a family. At point A, when they come to me for the diagnosis, it is not that easy. And also when you look back for evidence of, what is the outcome, there are a few studies, but we haven't actually captured that long-term outcome very well to be able to predict. We need to know the child's initial language level, cognitive level, which has some predictive factors, and also how they respond to therapy. So we need to be able to see the child initially several times to be able to get an idea how he is responding to early intervention. We don't know what the exact number is, but there are some kids, especially the ones who are at the higher end of the spectrum, the milder end of the spectrum, that do very well because they've got amazing cognitive ability. Or the children on the spectrum who've got a good cognitive ability, they are likely to do very well. Those with a good language ability could do very well and could by all means lead an independent life. There is a proportion of kids who do alright, and there is a hope for independence with those children. Then there is a proportion of children who require help and support always. So it's difficult to talk about which category the child is in the initial stage. We do need to start with the intervention, see the response, and then possibly discuss prognosis a bit later is what I do in my practice. But I think always promoting and giving families the idea that early intervention needs to be done, and it's important that it is done intensively, and parents also need to be engaged because that's again an important factor. It's not merely just therapy and that's it. It has to be practiced at home as well. So hard question to answer, and the prognosis can be quite variable, and the hope and the endeavor would be that we try early intervention and support the child gain as many functional skills as possible and aim for autonomy and independence.
So it basically goes to early intervention, consistent intervention. So it's like, if your child is weak at something, just help the child in the areas where he's weak at. So like, if you're weak at maths, you go for tuition and then follow it up at home. Similar way, if your child is having difficulty in some behavior, take help and follow the same thing at home as well.
Yeah, and those interventions will be language interventions, so communication strategies, behavior strategies, learning strategies, and then supporting the child to engage with other children. So these would be the important areas, and also sensory integration. So those would be the key areas of intervention for the child.
It was a really lovely conversation with you. Thanks a lot. I'm sure the audience would have been benefited with whatever you had to say. Thank you so much, Dr. Prathima, for making it here today.
Thank you very much.